This skull is over 5,000 years old, and that hole in it wasn't caused by a weapon or an accident. It was surgery, done on purpose. Look closely at the edge of the hole. The bone had started healing back over time, which means this person actually survived the operation. There was no anesthesia, no antibiotics, no sterile room, just a healer, a sharpened rock, and a steady enough hand to cut into another human skull. This procedure is called trepanation. Ancient healers used it to treat head injuries, violent seizures, constant migraines, and in some cultures, to release what they believed were evil spirits. Scraping through solid bone by hand could take hours, with the patient conscious through most of it. Archaeologists studying skulls from Peru, France, and China found survival rates as high as 50 to 70%, remarkable for the Stone Age. Since real anesthesia didn't exist yet, healers worked with whatever nature gave them: fermented alcohol, opium poppy extract, or coca leaves to dull the pain. In cases where no plant could help enough, the backup plan was simple: get a few strong people to hold the patient completely still. By 1600 BCE, Egyptian physicians had gone further than anyone before them. They'd written actual surgical manuals with step-by-step instructions. One surviving document, the Edwin Smith Papyrus, describes 48 real surgical cases: wound closures, dislocated jaws, even early tumor removals. Egyptian surgeons operated with bronze scalpels, sealed wounds using honey as a natural antibacterial, and stitched skin closed with strips of linen. Something Egyptian healers understood through observation, long before anyone knew what bacteria were. Centuries later, Roman army surgeons pushed battlefield medicine even further, treating soldiers with tools and techniques far ahead of their time. When an arrow struck a soldier, Roman medics used specialized hooked instruments designed specifically to pull the arrowhead out without tearing more tissue. Roman surgeons performed full amputations, using metal clamps to control bleeding well enough that patients often survived the procedure. The techniques developed by the Roman surgeon Galen were so effective that European doctors kept using them for the next 1,400 years. But here's the twist. Surgery itself usually wasn't what killed people back then. The real danger came afterward, from infection nobody understood. Nobody knew germs existed, yet some cultures instinctively cleaned wounds with wine or vinegar. And it worked, even though they didn't know why. Other healers packed open wounds with moldy bread. Unknowingly, that mold contained natural antibacterial properties, centuries before penicillin was ever discovered. It would take thousands more years before anyone understood anesthesia, sterilization, or bacteria well enough to explain why any of this worked. But the core instinct, cutting, removing, repairing, and healing the human body, that goes back much further than modern medicine ever gets credit for. So next time you're sitting nervously in a waiting room before a routine procedure, remember what people used to survive with almost nothing. Someone, thousands of years ago, survived actual brain surgery with a sharpened rock and someone else's steady hand. Modern medicine had a wild starting point. If you want more true stories about what ancient humans actually survived, subscribe. There's a lot more where this came from.